Good morning, this is Dr. Valdez from Hair Loss Solutions and welcome to our Medical Mondays. Today's topic will be platelet-rich plasma. One of the reasons that I chose this topic is because it's something I get asked about almost on a daily basis on our clinics when I see patients for hair loss. It is a fairly new treatment in hair loss restoration and it is quite effective. However, there are certain parameters for the patients that qualify for this procedure. Platelet-rich plasma is a process where when you come in to do the procedure, we take a sample of blood, almost like when you were going to your primary care doctor to have blood taken out for checking your cholesterol. That sample of blood is then put into one of the machines that we have here in the office that helps separate out the different components that we need from your blood. The two components that we look for are your plasma, which is the watery part of the blood, along with certain cells called platelets. Both of these are very high in concentration in two different things, growth factors and cytokine, which are the two main components that are going to help stimulate hair growth in the patient once we reintroduce the serum. We then prepare the patient's scalp. We reintroduce the serum into the parts of the scalp where the patient is thinning. And within about 4 weeks of this procedure, the patient starts to see thicker, fuller hair start to grow in the areas that we treated. In order for the procedure to work though, the patient has to have existing hair in the areas that are going to be treated. So in other words, the patient has thinning hair, but hair is still present. When a patient is completely lost hair in a certain part of the scalp, if you inject them with the platelet-rich plasma, you're not going to get results. So the patients that qualify are patients that have still hair present, thinning, but they want to have thicker, fuller hair to get better coverage in their scalp. And those are the patients that are the perfect candidates for the PRP. The procedure is fairly simple. It takes about an hour to do. A lot of patients we find will leave work for lunch, come here, do the procedure. We take, like I said, less than an hour or about an hour, and they go back to work that same afternoon. There is no downtime. There is no cutting, there is no surgery. Like I said, it's fairly painless. Probably the biggest step is drawing the blood for the patient, which is very simple to do, and most patients have experience with that, just drawing their blood for their primary care doctor. And the results are quick, as opposed to hair transplantation, where it may take 3 to 4 months just to start seeing the effects of the surgery. With platelet-rich plasma, or PRP, you can start seeing results in as little as 4 weeks. If you have more questions regarding platelet-rich plasma, if you'd like to see if you're a candidate for platelet-rich plasma, feel free to call us here at Hair Loss Solutions at 954-613-5777 and make an appointment. We offer free consultations, we do a hair analysis, and we can tell you what treatments we think would work best for you. If you have any topics that you would like us to cover on our Medical Mondays, feel free to write us on our Facebook page. I'll go through them and I'll try to incorporate them every Monday when I do these topics. Thank you.